Hi, welcome to The Cultural Barrier. My name's Belle.
And my name's Tej.
On this week's episode, which is sponsored by NIHR, we have a guest. So, Dr. Atia Nissa is a postdoctoral research associate from University of Bath. Now, most people, as you can tell, I always look at my screen because everyone knows I've got a really bad memory. It's just one of those things. Premenopausal, maybe? I don't know. But today, we'll be looking at young people's mental health. Now, the reason this has been really important for us is because last year, we're starting to work a lot more with young people. So we wanted to find out a bit more as to what research is going on out there and how it also impacts South Asian communities and ethnic diverse communities. So, hiya, Atia, how are you?
I'm great, thank you. How are you?
Yeah, doing well, thank you. Before we start, could you give us a bit of an introduction as to what being a postdoctoral research associate actually means and, what that entails, please?
Yeah, absolutely. So, hi, I'm Atia. I'm a postdoc research associate at the Mental Health Research Group at the University of Bath. So we've been recently established and we're funded by the NIHR in order to support health and wellbeing of young people in the region. So that's Bath, North East Somerset, Swindon and Wiltshire. And we're really focused on how we can kind of improve preventative care, but also interventions and increasing access and early uptake of mental health support.
Sorry, go ahead. Yep, go on.
Yeah, and we have kind of 4 different work packages. One is on digital self-help for common mental health difficulties. Another is supporting young people with behavioural difficulties. Third is understanding drug use, addressing drug use, and a final one on improving outcomes after adverse childhood experiences. And I work on work package 1, so that's digital self-help. And in terms of my day-to-day, it really varies massively what I do, but at the moment I'm in the process of setting up a big study that we're doing to evaluate a digital mental health intervention for young adults experiencing depressive symptoms.
That sounds like a complicated thing. Even Taj, you've just stunned Taj into silence.
Can we start off right from the beginning? First of all, find out. I know quite a lot of us now talk about mental health, but what does mental health actually mean?
Yeah, that's a great question. You can get very academic with the definition, or you can...
Layman would be good.
I was going to say, dumb it down for us, Atia.
Yeah, great. So there's a nice definition that I use. I've done a lot of school-based research, and that was what my PhD was in. And I think the definition that we really like, that we use with young people, is that it's about feeling good, feeling happy, feeling well at its core. And obviously that can encapsulate lots of different things. But I think the average person, that resonates. They have a good sense of what that means for them.
Can I get you to do the clinical explanation as well? Only because sometimes the sort of layman explanation, it's very non-specific and very subjective. So it'd be really interesting to hear if the clinical explanation gives us a bit more definitive sort of definition of mental health.
I would love to, but I would say there actually isn't one standardized clinical definition. It really would vary who you asked. I think that's an issue slightly inherent in mental health research. Probably a bit of a broader conversation to be had. So a researcher might have a different take, a clinician might have a different take, different mental health services, and then obviously there's the whole cultural element as well. So yeah, I won't get into a precise definition just because I don't want to say wrong.
I was going to say annoying people in different areas of mental health, then it sounds like it's obviously quite a contentious issue then, even that.
It can be a little bit, yeah. So it is quite broad, and that's why the layman's definition is also quite broad, because we do need to kind of tap into what all these different people might think of mental health as being, if that makes sense.
That's interesting in itself though, isn't it? Just the fact that we don't have one definition and that's for the whole of society. That's really interesting. In regards to young people, there seems to be a lot more focus we're finding on the well-being and mental health of young people. What's been the change, especially in research? Why has that changed?
Yeah, great question. I think we're realizing the impact of particularly early intervention. So most common mental health difficulties kind of arise in the early years, kind of in the teenage years specifically. And so I think there's a growing recognition of how early intervention, even before those teenage years, so thinking maybe primary school age, can be really effective in preventing those difficulties from occurring. And that's what a lot of research is now tapping into. I think I mentioned I've done a lot of school-based research, so that's looking at school-based mental health interventions in primary school, So what can be done at that stage before even any mental health difficulties are really manifesting? How can we kind of help build the skills, the coping skills, resilience, and so on? To stop it getting to that point where it's then a debilitating mental health issue.
Has it increased then, or has it always been there and we're just identifying it?
That's a great question, and possibly another contentious one. I think there's an argument to be made that it has increased. There's just increased, social pressures. There's a lot of discourse around social media, some warranted, some perhaps unwarranted. But I think it makes things a lot more visible, makes people aware of the different. I think we're moving beyond just the maybe traditional manifestations of anxiety and depression. People are starting to understand more broadly what mental health difficulties can look like. So things that wouldn't have necessarily been talked about 10, 20, 30 years ago, I think people feel more comfortable now talking about them. That probably has quite an impact on the visibility of mental health issues and our perception of, are there more of them, or are they just being talked about more? So yeah, I would say it's a little bit of both, essentially.
Okay. In regards to the South Asian community in that case, obviously a lot of our work is with ethnic diverse communities, especially the South Asian community. What would you say is the difference, I suppose, in mental health, and why is it being, why is there not enough exposure to ethnic diverse young people's mental health in research?
In terms of research, I think there's kind of several barriers which we're starting to understand. I wouldn't say it's fully understood yet. We need to do more research to even know what these barriers are, which is a bit of a slightly cyclical loop. But I think a big one can be a lot of South Asian people and young people in particular might not see as research being for them. They don't feel represented in it, so they then feel that it's something they're not qualified to be a part of. They might see it as something quite separate for them. They might not feel they have a valuable input. I would really love to dispel that notion. Essentially, research is for everyone, and it's really fundamental that we have input from a wide range of backgrounds.
Why? That's the question then leading on from that. Why is it important to have a wide range of people participating in research?
Yeah. So in terms of, I'll talk about South Asian people specifically because that's the topic today. But in terms of then when we're trying to increase access and engagement and tailor treatments for specific groups, in order to be able to do that, we first need that input from those groups at an earlier stage to understand the specific nature of their difficulties. If we're testing an intervention, a mental health program, for example, if we don't test it with that specific group, we can't say if it does or doesn't work for them. So it's absolutely fundamental that we have everybody involved from the start all the way through the research process, all the way to the end when we're sharing the findings as well. Otherwise, it just simply doesn't work, and we can't generalise to a subgroup. So say South Asians if we haven't done the research with them in the first place.
So what kind of, sorry, Belle, I'll keep jumping in, but I've got another one, I'm going to do it. What kind of participants are you getting at the moment for the research?
Yeah, so I think I can't speak for all studies, but generally it's what you'd expect in terms of white British young people are the majority in mental health research. And then it varies kind of study by study and regionally as well, I suppose. So obviously, so I'm in Bath at the moment. It's not the most ethnically diverse city, so you would expect more of a white British participant base, but we also need to still be reaching, all these underserved communities such as South Asian young people as well.
Can I go back? What does research actually entail? So are we talking about drugs? Are we doing specific procedures? What is it that you specifically are researching, about to research as well?
Yeah, so research is so many things. I'll talk about two things that I'm working on specifically, which might give it a bit more kind of context.
Yeah.
So we're thinking specifically mental health interventions, mental health research, and I do very applied research. That means kind of taking treatments, mental health treatments, testing them or adapting them, and then seeing if and how they work. So to give the example of what I mentioned at the start, so I'm currently looking at a single session intervention for depressive symptoms. And what that is, it's a short kind of 20, 30-minute program, online activity that a young adult can sit down independently and go through. And the idea is that it will hopefully help improve their mood and reduce their depressive symptoms. So
What
it's not
kind
to
of
say,
actually, I was going to say, what kind of activity? Because as soon as you say research, a lot of people would think it comes down to drugs, and especially when it's mental health, that tends to be a bit of a fear that, well, for me, I suppose, not everybody actually, that it might be a drug intervention. So, what are the activities then that you'd be talking about there?
yeah. So these are psychological activities. So in terms of the specific one that I'm talking about, this is something called behavioural activation, and it's essentially getting people to engage more in activities that they enjoy doing, but they might be struggling to do because of the nature of their depressive symptoms. So it's kind of a guided activity to help them identify what they like doing and what their values are as well, and how they can kind of act more in line with their values. And hopefully the outcome will be that subsequently has an impact on their mood and improved mood. So that's what we're testing. So we can't say definitively, yeah, if it does or doesn't work, but that's what we'd like to find out. And that's what a lot of kind of mental health research trials in particular would look like. But trials are just one kind of part of the puzzle in terms of the research.
Can I ask, Atia, sorry, now I've got 100 questions just because I was like, oh, activities. So are you talking about things like hobbies? So whether, I don't know, knitting, colouring, art, things like that. And so you're trying to see if they do more of those activities, it then has a clinical benefit for their mental health.
Yes, in terms of this one very specific trial study that I'm looking at yes, it would be just day-to-day activities, anything that a person identifies as they like doing. So it can be literally anything. It could be watching
What
films
about gaming?
could be gaming. Yeah, it could be
So it could
literally
be that.
anything that.
Okay.
Yeah. So this program, because it's self-guided, a lot of the input comes from the person themselves. So we've quite.
What do you know? I'm just like, okay, so this sort of makes it. We know we do wellbeing workshops. Been doing them for years because it gives people a chance to get together, do something they enjoy, learn something, but also have those conversations and reduce social isolation, which essentially is, trying to improve their moods. From that study, and I know it's only one study, and I'm like, oh, that's really interesting that you're actually testing whether this clinically has benefits for it. What are the initial results, or any results? Has it seen any positivity and it does have a clinical benefit then?
Yeah, so we haven't tested it. We haven't started this study yet. We're
Okay.
aiming to start next month. However, behavioural activation, kind of as a concept, more generally, has been tested quite thoroughly. It's part of cognitive behaviour therapy, which I'm sure you're familiar with to some extent. And it has been, quite rigorously tested over the years, and it is very much established to have clinical benefit for a range of mental health issues. So the idea with this particular intervention is just making it as accessible as possible. So that's the whole concept of digital health, is that we're kind of removing a lot of the traditional barriers that we'd see with service access. So there are some young people who might never go to their GP and ask for mental health support. So it's about reaching them in different ways. And so, digital mental health is a really great way to achieve that, because almost everyone is online nowadays. Anybody can just log into something and do a 20-minute activity, ideally. So if that works, that's fantastic. So we want to really establish that.
And how do you measure it? How do you see, I suppose you do it before the activity and after the activity? What is the actual measurement, and how do you know that it's made a difference?
Atia is going to be like, I mentioned one thing and you've gone really deep into this.
No, great, love it.
I was just trying to understand, is it just drugs? Because that's what comes up in your head when you say research. But actually, it just proves that it's not. There's a whole world out there, which if you engage with in research, we just don't know. And that's the point of this. So sorry, go ahead.
I think we definitely need to do more to kind of dispel that notion. Obviously, there are drug trials out there, that's quite separate from what we do here in the mental health research group. Is definitely kind of psychological therapies focused. And sorry, yes, what was the?
How do you measure, like, before the activity and after the activity? How is the results found, basically?
Yeah, so we have a kind of a range of clinical outcome measures, and in this particular trial, how we do it is that the person, once they enter the study, they'll just complete all the questions almost as a survey before doing the activity. And this is something called a randomized control trial. So we'll actually randomly assign half the participants to do the activity. The other half will then continue to just do their usual care. So they essentially won't do anything new. And that's so we can compare and see if there's a difference between the two groups. So when one group receives this intervention, does it make a change? So immediately then after doing the intervention, they'll complete some more outcome measures, And then 1 month later, we'll invite them back to complete them again, and at 6 months as well. And this is how we can test kind of long term, is there an impact of the programme on their mental health outcomes.
I'm about to go off on a complete tangent, and I'll shut it down very quickly after it can be a yes or no. But if that's the case, and we're looking at digital ways of making people's mental health better, is this something, and you don't have to answer this, is this something that social media organisations should be looking at because of the bad press that they've already been getting? And is this something they should actually be funding at some point?
Yeah.
Because obviously research is so underfunded as well.
Yeah, that's a great idea. Not really thought about it too much, but now you say it, I think.
There you go. We give ideas as well here.
Yeah, great, and we love this. I think hearing people's research ideas is something we don't really get to do enough of, and I think we've tapped into something potentially amazing there.
See, I have something.
So yeah, come back to me after. We'll plan a study.
Let's do it. Right, okay,
What is the age group that your this study is being? What's the word? Studied? That's not even the right word.
Yeah. So this particular study is 19 to 25, but there is also a similar kind of adjacent study going on at Bath as well, which is the 13 to 18 age group. We have separated them out slightly just to acknowledge the fact that if you have a program that works with 13-year-olds, you probably need to tailor it differently for 25-year-olds. So we've essentially got kind of slightly different versions that we're testing, but yeah, ideally we'll be able to test this with lots of different age groups over time, but that's what we're focusing on for now.
And what kind of numbers are you looking at? I know we're going really deeply into this study.
Yeah, that's great.
Understanding as to, how, if it's hard to get people into research, what kind of numbers are you trying to get to show actually this statistically significant, the information that you're getting?
So yeah, in terms of this particular study, we've calculated that we need 264 young adults, which we think is, hopefully reasonable. This is a completely online study, so it doesn't involve any interaction with the researcher. So what we'll do, we'll advertise the study kind of on mental health organisation websites such as Cooth and Shout. Then people can click through to our website, which is called Unlock Wellbeing, where we'll have the study adverts. And then if they choose to enter the study, we'll check for eligibility. We'll get informed consent, of course, and then they can proceed into the study. So it's hopefully very accessible, removing a lot of the traditional barriers to research, which, people might be hesitant to speak to a researcher, or they just want to do the study. They don't want everything around that. So hopefully that helps us a little bit as well.
Okay, so we've gone into real depth of your specific study that you're going to go into. Didn't mean to do that, but thank you very much. Drugs, activities is something you're researching. What other type of things is included within the research realm?
Yeah, so I think two main things that I'd like to touch on is patient and public involvement. Sorry, we have a lot of acronyms in research. Gets hard to remember what they all stand for. And so the idea of that is essentially involving people with lived experience right from the very beginning. So we're not just having people engage in the actual research activities, so for example, being part of the trial, but actually even when we're starting to think about what a study should look like. So if I wanted to adapt a mental health intervention for South Asian young people, I should be involving South Asian young people right from the very beginning. So we do lots of those kind of activities, and I think research is really much catching up to this idea that we need to be doing this as standard, rather than kind of like tagging it on to things. It actually needs to be just inherently a part of the process. So I do spend quite a lot of time doing that, and I really value that element of the research. It's really nice to get to sit down and talk to people, get their views, and incorporate them into everything that we're doing, really just co-producing everything that we're doing throughout the whole research life cycle. So that's a really big element. Then another piece of work that I've just started on, so I've just been given my first piece of funding, so independent funding. Thank you very much. A big moment. And so I've been given the funding to actually look at how South Asian young people look for mental health support, particularly online. So where are they looking? How do they look for it? But also, how do they feel about its cultural relevance? So do they think it fits in terms of their experiences, and does that make them more or less likely to engage with it? And the idea of this piece of work in particular is to create a set of guidance that can be kind of shared with schools, colleges, charities, organisations such as yourselves, to just kind of help signpost mental health services a bit more effectively for these groups, and also see what we can do to kind of adapt things a little bit more so that young people, South Asian young people, are accessing them at a greater rate, and also hopefully be more effective down the line.
It's really
Why was this because obviously you would have thought about this project. Why did you think this was an important project?
Yeah, I think I've been wanting to kind of do this kind of work for a long time. And with research, you kind of have to take whatever opportunities come to you. So it's been, I think a lot of it comes from my own experience being a South Asian and, navigating mental health as a younger person, and just recognising just the little differences between myself and white British peers, but also not just my experiences, but also my friends as well. Just those shared experiences that we've had as South Asian second-gen immigrants in the UK, and just kind of recognising those little differences.
What are those differences?
Yeah, oh gosh, there's so many. I think being a third culture kid, I don't know if you're familiar with that term, but I think
I'm not. I'm probably too old. I don't know.
No, it might be kind of a US term that I've just brought over and nobody knows what it is. But it kind of refers to this idea of you don't completely tie in with your parents' home culture, you don't tie in with the culture here in the UK, but it's actually a combination of the two which creates something else entirely.
Yep. That's the point of this podcast, Atty.
Yeah.
What did you call it?
Third culture kids.
Third
culture.
We're going to totally steal your term.
I'll send a different definition so we can make sure we're talking about the right thing. So it's just this concept of our experiences being third culture kids manifest quite differently, and it's something that can be quite hard to define sometimes. I think it resonates with a lot of people, a lot of other second, third gen immigrants, but it's hard to sometimes say exactly what it is. I think there's a lot of things that go into it. So there's the cultural pressures in terms of education, attainment, the job roles that you go into. Obviously, there's very specific mental health pressures in terms of how that manifests, how that's talked about, the shared language or lack of shared language around mental health, and there's so many things we could talk about.
Do you know what it is, Atty? I mean, you've just said those things, and me and Taj are like, yep, we get it.
Yeah.
We get it.
Yeah.
Because there is that common understanding of we get it. With your peers who are researchers, and you've obviously had these conversations because you're about to embark on a project yourself, what has been the response to people who might not have who haven't gone through those experiences? Do they get it in the same sort of way, or do you have to explain it a bit more as to what your research project is?
I think the response has been really lovely, really positive. Everyone's been super supportive. I think where I am here in Bath, that there aren't really any other South Asian researchers. So it can be a little bit scary embarking on this kind of work when you're the only one. But saying that everyone's been really wonderful, really engaged, recognizing how important this is. And I think this speaks to the kind of the wider research culture within kind of mental health at the moment, that there's such a big move towards inclusive research. So we've got a research inclusion strategy here in the mental health research group. So everyone, even if they don't maybe necessarily know the nuances of the struggles that South Asian young people go through, they're really interested to learn about it, and all the questions about it come from a really positive place. Generally there's this really strong recognition of why we need to be doing this kind of research, which I see is really positive in terms of future work after this, because obviously this is just a stepping stone really in terms of the very first engagement with mental health that South Asian young people have, but then we need to look more downstream as well in terms of the treatments and how we can adapt those to be culturally relevant and so on. So generally it's been really nice applying and doing this work.
Is that something, because obviously you've said you're based in Bath, with London for example, do you see, is there very much research being done in the same sort of field that you're about to embark on, or is this quite a new area? Only because I know with London, I was a researcher in London, and anyone that goes to a lot of the universities over here are Asian, but you don't tend to see the corporates being Asian. The researchers and the scientists are very much of that ethnicity. So is a lot more being done into research for the South Asian community or ethnic diverse communities in other areas, which perhaps isn't in Bath because of just the you're the only Asian in the village, as it were.
So I'm aware in London, there's definitely a lot more. So, when I've been to conferences and things and I have kind of engaged with other South Asian researchers, they tend to be at the London universities. There's quite a big contingent in Manchester as well. So just kind of those areas where there are more South Asian people, which does make sense. But I do think we need to be kind of branching out beyond that, because like I mentioned, obviously Bath is not super diverse demographically, but I think that almost makes it even more important.
Yeah.
So imagine being a South Asian young person here where you may not see anybody like you, like on a day-to-day basis. That's even more difficult. And I can kind of relate to that in terms of, in my primary school, I was for a long time the only South Asian person, other than my siblings, who I don't think count. And it does, obviously it does shape you from a very early age. And I think, I don't know if you can relate, but you do get the whitewashing accusations just because of how you've grown up, because you've not grown up with, lots of other South Asian young people. So it can be an interesting thing to navigate.
So the field of research is interesting because of the people that you're around. But the fact that you got funding for it, and it is very hard to get funding for projects. And that's something that, I remember back when I was doing it, it is very hard to do that. So obviously, wherever you got the funding, there is that sort of understanding that this is something that needs to happen. And that's why they put funding towards it.
Yes, and I'm hoping this is a positive sign in terms of, just wider research. Obviously, the South Asian community is really important to look at, but equally, other ethnic communities, I think, deserve that kind of level of funding as well.
I was going to say the areas that you live in also make a difference as well. The saying that you're surrounded, not surrounded by many South Asians or that many at all, compared to, for example, London. So you'll have people participating in the research from different areas as well, I'm assuming?
Yes. So that is something that varies study by study. So in terms of the trial I talked about earlier, so that's open to everyone in the UK, and that obviously isn't just South Asian focus, that is for everyone. But then in terms of this research that I'm doing, in terms of creating this guidance for South Asian young people or about where they look for mental health support, I'm aiming to look at 3 different places. We'll see how it goes, see how far the funding stretches. So I will be kind of doing some schools in Birmingham and London, just because they do have those large South Asian populations. But as a more kind of a local take, I would potentially like to come to Swindon, if anyone.
We've got a diverse community here now, to be honest, quite diverse. Yeah.
So I think that would be really valuable.
With the fact that you've said earlier in the podcast that you don't get many people from ethnic diverse communities, the South Asian community, that are coming into research, and you're about to embark on a research project specifically for ethnic diverse communities, the South Asian community. How are you planning to go out there and firstly advertise and make sure you get the people recruited onto your study? Because there is a big trust issue between research and ethnic diverse communities because of what has happened in the past. So how do we break through that barrier to help research projects like your own?
Yeah, so in the case of this particular project, I'll be looking at going through schools, which are a really great way I have found to kind of reach kind of diverse populations, because obviously, almost all children go to school.
Captured audience.
So, yes.
So Asian children go to university.
Yeah. So that can be super, super helpful. So I'm partnering with the Wisdom Network. So they're based at the University of Oxford, and they have links with schools all over the country. So I'll advertise through them and specifically seek out schools with large South Asian populations. And actually, so who I'm partnering with, Dr. Julia Badger was my colleague back at University of Warwick, and we did a piece of work looking at culturally diverse schools in Birmingham and how they support the mental health of their populations. And that was actually the kind of first piece of work I did in this area, and it's really pushed me to want to continue it, especially, I'm going on a bit of a tangent here, but I think a key finding we found that was that teachers recognise the need for culturally adapted resources and the fact that they don't really exist in terms of mental health provision for young people. So that has made me want to do that kind of down the line. So that's kind of a big research agenda I'd like to.
Why do they need adapted? I mean, we're talking about second, third generation where, we understand English, we read it. I mean, we will get A's in our A levels and probably do English at university as well. Why is it we still need adapted types of resources then?
So I can only really speculate as to this because I don't think the work we need to know for sure has been done yet. But I think a big part of it would be values and just the difference in values. And it kind of goes back to that kind of third culture, where there's a bit of, I don't want to say friction, but so I think we have a toe in both the more kind of collectivist cultures from the East, where it's more family oriented and you do things, with that in mind, and that's how you go through life. But then we also live in quite an individualistic society where, it's more you do things for your own personal gain, which sounds a little bit harsh. There's probably
That's
true to say it. So, and a lot of mental health programs and provision that are kind of used in schools, they're very values based. So it's kind of it's asking young people to identify what are your values and how can you act in line with those. So I think if we are centering values in terms of a means of supporting mental health, we need to kind of acknowledge what the different values are. So that could just be one element of how we're adapting these resources. And then the other big thing, I suppose, is engagement with parents. Obviously, there's still a big cultural divide in terms of how parents and that generation think of mental health and how kind of young people now. And I think navigating that can be difficult for teachers as well. So if they want to speak to parents about their child's mental health, that can be quite difficult. So I think they could really do some guidance on how to kind of approach that. So that's one element. But then also there's thinking about, specifically if you're working with a young person, a South Asian young person who has mental health difficulties, how do you support them in speaking to their families about that? So there's quite a few layers to it.
I just want to clarify. So the South Asian community that you're wanting this study, not just British born, they can be from abroad as well. Is that correct?
Okay. Yeah, absolutely. Yeah.
Then they will face, because we work in schools as well, so they will face other pressures like integrating into schools, and they will have that language barrier. That added element of things when you move over. So it's really important that we know that. And what is the eligibility criteria for being in the studies, in the particular one? I suppose there's different ones for each study, but in the study that you're working on?
Yeah, so in terms of the focus groups that I'll be doing in school, it will be a 13 to 18 age range, and the only real criteria is that you're a South Asian young person, and that's it. Because this is not even necessarily looking at young people who already have mental health difficulties, and if they do, obviously that's absolutely fine. But it's more about if they started to struggle, where would they look? Where would they first turn? And what would help them in terms of looking for support. So it's a really broad kind of inclusion criteria, which we try to do as much as possible because we don't want to be cutting people out of research unnecessarily. And obviously it's quite difficult to get large numbers, so the more barriers we put in place, the harder it gets.
I was just thinking, again, location. Would you be looking at mainstream schools, grammar schools, private schools? Because I would feel that there maybe are different pressures if you're going to a deprived area, if you're probably maybe going to a grammar school. I'm not saying that the student might not come from a deprived area that's going to a grammar school, but whereas in a private school, you'd have people that have got a bit of money to send the child to that school, so they might have different kinds of pressures. Is that something that's been looked at as well, or?
Yeah, so in terms of this particular study, it is quite a small one. It's a small part of funding, so I'll probably be looking at 4 to 6 schools maximum. Obviously within that, I'd like to get as much kind of diversity as possible in terms of socio-economic circumstances of the young people. So ideally, have one mainstream school, maybe one private school, and so on. I think that's something that needs to definitely be considered more broadly. I think you could do a whole other podcast on this, but thinking about social class is another really kind of underrepresented, underserved group, but particularly thinking about the intersectionality of South Asians and how that interacts with social class. I think there's a lot to do there. I'm not really aware of much, if anything, that's been done. So that's something to add to the agenda. So.
This idea that we're giving you.
This is great. Keep moving.
This is the thing, though. I mean, with the age group, that if it was older I'm still a young person, but I'm slightly an older young person.
Yeah.
Yeah, okay.
It's an interesting sort of dynamic because 13 to 18, it is going to the parents, making sure that they understand what mental health itself is, understand what research is. And so there's quite a big hill to climb, isn't there? Because not only do you need to cover the parents, but then you've got the children who actually might be slightly easier because there is more acceptance of mental health.
Yeah.
But now you've got two different barriers within research, haven't you? Not only is it the cultural, you've got the multi-generational aspect of it. And, if you should go back to your funder and say, well, actually, there's even more barriers in the research project that I'm doing, double up.
Yeah, exactly. There's so many things we need to understand a little bit better. I think in terms of even as the older generation is now starting to understand mental health a little bit more, it's still quite limited. Of like depression is the main one you'll hear about, most of the time, that they might have some understanding of. Obviously, mental health is much broader than that. Even in terms of common mental health difficulties, you have anxiety, but then kind of really severe mental health illnesses, OCD and bipolar, still really heavily stigmatized. So there's incredible amount of work still to do there in terms of
because there's acceptance
stigmatizing.
It's acceptance from the parent that actually my child may have a mental health problem, and also the fact that you've got the community aspect of
it's always what will they think,
exactly that. Our favorite phrase on this podcast apparently. So in regards to, as we come to the end of this podcast, I mean, it just shows as to the barriers as a researcher, what you're having to go through to just get to the point you're trying to get to. And that's without even recruiting people onto the study, isn't it? Not only is it you're working against a system essentially, because a lot of funding does not go to ethnic diverse communities specifically, it's specific funding. So you've got the systemic problem, but also you've got a community problem where you've chosen a hard area. Mental health is a tough area. You're obviously a girl that likes a challenge.
That's why I did a PhD.
Fair enough. She got her doctor, which is all you need. You can stop now, Atia. As we come to the end of this podcast, what message would you like people that do listen to this podcast to take away with them about the importance of getting involved in research from the South Asian community?
I think the main thing would be just we all need to be acknowledging that mental health care isn't one size fits all. So we do need tailored treatments, tailored understanding of how mental health difficulties manifest. But we can't do that without inclusive research and having people from all backgrounds involved in the research. So, if you're somebody who's interested in research or being part of it, but, you have concerns, queries, you don't know what it would entail, just please ask questions. Researchers love being asked questions and answering them. And hopefully we can kind of demystify things, destigmatize involvement if that's a concern. So, and I think as researchers as well, we've started to recognise this, but we need to lean into the fact that we need to be doing research with communities, not about them. So they just need to be integrated from the very beginning.
Yeah, and that's a really important message. I mean, one thing that you said earlier was actually we are a very community-oriented community. So it does really work to the fact that research is exactly for that. By getting involved in research, you are essentially helping other generations and other communities on a longer term. So it does work in parallel, I suppose, with values from the South Asian community, essentially.
Absolutely, yeah. So I think with my own kind of ethnic background, there's a big emphasis on being charitable, helping others, helping people less fortunate than you, and I think this is an absolutely great way that people can do that.
Perfect. Thank you so much for coming on, Ati, and it's so interesting to hear
thank you for having me.
The research that is currently happening in an ever-changing world that you just don't realise that is happening, and it is important that it's happening as well. So thank you for coming on and explaining that. And good luck in your research project as well. I'm really looking forward to hearing the outcomes of it.
Yeah, thanks so much. Hopefully I can come back and talk to you about the findings when we have them.
Lovely. That's goodbye from me.
And goodbye from me.
Follow us on Instagram and Facebook, changing_suits, and subscribe so you never miss an episode.